Hello, everyone. I was just going to introduce myself really quickly before I pull up my slides. My name is Kayla Valigura. I am a PGY1 resident at Magnolia Pharmacy. And today I'm going to be talking to you guys a little bit about how to manage your thyroid, taking that functional medicine approach. So give me just a second while I share my screen here. Okay, so like I said, we're going to be talking about a functional medicine approach to managing your thyroid. So getting into the learning objectives, this is kind of a 10,000-foot view, but we're going to discuss the general thyroid function. We'll also get into the pathophysiology of thyroid disorders and kind of going over the symptoms and what those kind of look like. We'll also review some key lab markers for thyroid disorders, excuse me. And then we're going to discuss various functional medicine approaches to managing your thyroid. So let's go ahead and get into it. So to begin, I thought I would start with what the thyroid actually does in the body. When we have a good understanding of what the thyroid is doing for us, it's helpful, just to understand the overall disease state. So you can see here, it is pretty much based on this list, it regulates the metabolism, growth and development, so in children, as well as, in young adulthood, regulation of body temperature, heart rate and cardiovascular function, as well as digestive function, and the list goes on. So you can see it pretty much affects the entire body, head to toe. So it is very important that we have a good understanding of it and that we're managing it well. So just a little bit of background, getting into kind of how the thyroid actually works. The thyroid gland does not work alone. It's part of a powerful communication system called the HPT axis. And basically what that means is that it has a direct line, a direct communication to the brain. So kind of walking you through it, the hypothalamus senses low thyroid hormones or low body energy levels, and it'll go ahead and release thyrotropin releasing hormone or TRH to signal the pituitary gland. The pituitary gland then releases thyroid stimulating hormone or TSH, which you might be familiar with if you have been dealing with a thyroid disorder. That is a common lab value, which we'll talk about. And so the pituitary gland releases that TSH, and then the TSH is actually what tells the thyroid to produce hormones. So then we get to the actual thyroid gland, which then produces thyroxine or T4, which is the inactive form of our thyroid hormones, and then the triiodothyronine or T3, which is the active form. So just kind of a breakdown of those two hormones there. So we have thyroxine or T4, and this is actually our predominant hormone that is produced by the thyroid gland. So when the thyroid gland is actually secreting hormones, we're secreting mainly about 80 to 90% T4, so that inactive form. And we'll kind of look at the structural component in just a second, just for a visual, but it does contain 4 iodine atoms. And again, like I said, it is inactive until it's converted to T3. So it's kind of our storage form of our thyroid hormones. So then we have our T3, and this is mainly converted from T4 via deiodination, basically taking away one of those iodine groups, or an iodine atom. And this happens in the kidneys, liver, and the GI tract. So kind of foreshadowing here, if our kidneys, liver, and GI tract are not healthy, then we are already kind of setting ourselves up for failure in terms of converting that hormone to the active form. And the T3 is actually 3 to 4 times more potent than T4. So just for visual, I thought I'd include a little bit of MedChem here. I know that this is kind of in the weeds, but it does give you a good idea, being able to see those iodine groups. So I've circled those with the red circles here, and you can see the one on the left here is the T4 with the 4 iodine groups, and then the one on the right here is the T3. Okay, so talking about T4 to T3 conversion. So I told you that the T4 hormone by itself is inactive and must be converted to T3, the active form. So a majority of the T4 that's secreted from that gland, that 90%, 80%, is actually converted to T3 as well as reverse T3. And what reverse T3 is actually the iodine group gets taken off the wrong ring here, is basically what that comes down to. So it is converted in equal parts T3 and reverse T3 in a healthy individual. And then the rest of the T4 is actually metabolized through different pathways. So 80% of circulating T3 comes from the conversion of T4 via the loss of that iodine atom, which I previously mentioned. And again, as I mentioned, it happens in the liver, kidney, and the GI tract, as well as some other peripheral tissues. So there are actually some medications that can inhibit the conversion of T4 to T3. And I've listed kind of the medication classes here for your review. So getting into what thyroid disorders look like. I've broken it up into hypothyroidism versus hyperthyroidism, and I have bolded some of these here. You can see fatigue, weight gain, brain fog, depression, constipation as well. Those are pretty ambiguous in terms of how, as far as symptoms go. You know, a lot of us live busy and stressful lives. Fatigue and weight gain and brain fog is kind of, you know, something we all deal with, at least from time to time. So that I just wanted to point that out because it can be difficult, especially whenever you're first getting diagnosed with a thyroid disorder. Sometimes these things get missed because doctors aren't necessarily taking the time to dig into the details. But you can see here we have our hypothyroidism. So it's, you know, that cold intolerance, that weight gain, everything's kind of slowing down. You can kind of think of it that way. And then our hyperthyroidism, everything's kind of speeding up. So you're going to have more anxiety, more restlessness, excessive sweating, heat intolerance, weight loss rather than weight gain, as well as hair loss and diarrhea, things like that. So what actually causes an underactive thyroid or hypothyroidism? So the main cause of hypothyroidism is actually autoimmune disorders or what's called Hashimoto's thyroiditis. So we're going to talk a little bit more about that in a second, but that is the leading cause of hypothyroidism. There are also other causes such as an iodine deficiency. If you were previously in, if you previously had Graves' disease or you were in a really hyperthyroid state and you had, you either had your thyroid gland removed or had radiation therapy, that can lead you into a hypo state. Medication induced, which we kind of discussed, chronic dieting, environmental factors, estrogen dominance, and chronic stress I left bolded, which we will kind of touch more on later in the presentation. So getting into Hashimoto's, what it is exactly, it is when our immune system, like I said, it's autoimmune in nature. So that's when our immune system mistakenly attacks the thyroid gland, leading to chronic inflammation and eventually hypothyroidism. Majority of hypothyroid cases are autoimmune in nature, as I previously mentioned. And these antibodies that are produced are almost always triggered by what's called molecular mimicry. And basically, a good example of that when it comes to thyroid disorders is gluten. Whenever someone that has one of these autoimmune conditions intakes gluten, whether it's a lot of gluten or a little bit of gluten, our body is recognizing that as it looks very similar to our thyroid tissue. And so it leads to confusion with our immune system, and in turn, our immune system starts attacking our thyroid tissue. And kind of depending on if you have been diagnosed with Hashimoto's, kind of depending on at what point in the disease that you are diagnosed, it kind of varies with the amount of damage that's been done to the thyroid tissue. So just keeping that in mind. And key factors associated with the onset of Hashimoto's include gut dysbiosis, nutritional deficiencies, infections, environmental triggers, and as well as genetic predisposition. So hypothyroidism can be kind of broken up into categories. So we have primary hypothyroidism with kind of three subcategories here. We have our overt hypothyroidism. So that is what you think of when when you're thinking hypothyroidism, this is what comes to mind. This is a classic example of hypothyroidism where our TSH is high and our T4, T3 is low, and we are experiencing those symptoms that I was discussing. There's also subclinical hypothyroidism. So that is when TSH is elevated, but our T4, T3 is normal. And so a good way to think about this is, just because our TSH is elevated, just because that number is high, that's our brain signaling that we need to make more thyroid hormone. But our thyroid hormone in this scenario is not necessarily responding to that TSH. And we're still experiencing symptoms because we are in, even though our levels look normal, we're still kind of at a misbalanced ratio, so to speak. And so we're still experiencing those symptoms. And kind of along those same lines, functional hypothyroidism. So kind of in that ratio thing I mentioned, it's just that when TSH is normal or only mildly elevated and our T4, T3 is normal, but we are still experiencing symptoms. So yeah, I don't want to get too much in the weeds with that, but just kind of explaining that there are different breakdowns. And I think that's why it's really important to understand how these hormones work, as well as, what these different lab tests will kind of tell us, which we'll get into later. And then I won't spend too much time on it, but secondary hypothyroidism can be caused by a problem with the pituitary gland. So, a tumor or things like that. This is actually a problem in the brain aspect of this system. So what about an overactive thyroid? So some hyperthyroidism causes. The first one that is associated with hyperthyroidism is that autoimmune disorder called Graves' disease. So it's kind of similar to the Hashimoto's, but now we're on the opposite end of the spectrum. So our body's producing antibodies that are stimulating the production of too much T4. It can also be caused by excessive iodine. And I just had a note here to be cautious with supplementation. I know that it's kind of a buzzword, so to speak. And whenever you're kind of learning about the thyroid and well, oh, my thyroid needs iodine, I need to, supplement, that can actually lead to more problems if we're not closely monitoring and following up with our providers. Some other less common causes are overactive thyroid nodules as well as thyroiditis. So that's, kind of outside of the scope of this lecture. So now we're going to talk about some key lab markers. So we have TSH, total T4, free T4, total T3, free T3, reverse T3, and thyroid antibodies. And then I included at the bottom there a bonus lab. And basically those two, the ferritin and the vitamin D, can be, kind of investigated if we have done all of these other labs and we're still haven't quite nailed down what the problem is and kind of where things are going wrong. So TSH, this is a first-line screening for thyroid dysfunction. This is what all doctors are taught to look at first when it comes to thyroid disorders. And this, I spoke about it briefly at the beginning, but this is happening in the brain. This is being released by the pituitary gland. So this is a TSH measurement is merely measuring the communication between the pituitary and the thyroid. And being that this is the brain piece of it, it is very helpful for us, but it is not an end all be all. We can't just test TSH and know what's going on. We need to do further testing. So, abnormal levels are associated with early thyroid dysfunction, but as a note here, small TSH deviations may not have clear long-term effects, and normalizing TSH doesn't always correct other thyroid markers or symptoms. So kind of building off what I was saying, that we really can't base everything off TSH, and it's an important lab marker for sure, but we definitely need to take other things into consideration as well. So getting into our T4 and T3 lab markers. So we have total T4 and T3. And that measures both the protein-bound and the free hormones. So we can think of our protein-bound hormones as the ones that we're kind of storing away for the time being, and our free hormones are the ones that are more or less floating around and ready for us to use them. The total T4, T3 is easier to measure compared to free hormones. And then getting into the free T4, T3, this measures the unbound biologically active. So like I said, the bound ones are inactive, they're kind of our storage form. And then our free hormones are the ones that are available for our body to use. This one is more difficult to measure accurately and precisely because it is such a tiny, tiny, minute amount that's floating around. And so it's a very difficult measurement. But our free T4 does more accurately reflect how the thyroid gland is functioning. We can also measure free T3, but it is the last test to become abnormal, and it tends to be unreliable because of that small amount in our system. So I spoke briefly about the reverse T3, and I mentioned that in a healthy euthyroid patient, they should be converting their T4 in equal parts T3 and reverse T3. Typically, reverse T3 it's produced normally, but then it's rapidly degraded. This is actually an inactive form of T3. So our body is not able to use it in the same way that it can use T3. And it should be interpreted with TSH, T4, T3, and thyroid antibodies. So this is a helpful lab value. This is typically one that's done more when we're doing a little bit more investigating. This may not be something we look at right off the bat, but it can be helpful in giving us more information about what's going on. So some causes of excess reverse T3. Stress is a big one. Cortisol increases conversion of T4 into reverse T3 and kind of forces it into that pathway versus splitting it evenly. And along with that, inflammation as well can lead to excess reverse T3. Poor blood sugar management, insulin resistance, crash dieting. If you're doing a lot of fad dieting and putting your body into that stressful state, that can also lead to excess reverse T3. And then there are some medications as well. Okay, so our thyroid antibodies, I don't want to get too in depth with this, but I did mention the two autoimmune disorders related to the thyroid, so Hashimoto's and Graves' disease. And basically, when we're looking at thyroid antibodies, if these are present, then that means we know that our body is incorrectly attacking things that it shouldn't. So I'll just kind of leave it at that. I've listed out, a few of them and kind of how we are able to differentiate between Hashimoto's and Graves', but I'll kind of leave it at that. So since I am talking about lab markers, some quick tips for lab draws. So ideally, drawing labs 4 hours after you dose your thyroid medication. And then along with that, testing the same time every time. And what I mean by that is ideally, we want you testing 4 hours after you've taken your thyroid medication because that is going to give us a more accurate look at what's going on and how our body's kind of handling that and metabolizing it. But say, you go do labs today and your labs are drawn 2 hours after you've taken your thyroid medication. The next time you go to draw your labs, you would want to do 2 hours after you've taken your medication as well. Because if you were to say go 6 hours after you've taken your medication, we're going to have drastically different lab values, and that's going to lead to, more confusion in terms of getting to the root of what's going on. A couple other tips for lab draws is resting for 15 minutes before labs are drawn. There's evidence that by doing this, if we aren't resting 15 minutes before we do those draws, we can have a inaccurate high level of TSH, or our TSH is inaccurately depicted higher than it actually is. And kind of along the same lines, avoiding biotin supplements at least 72 hours before labs are drawn. And that's because it can cause falsely elevated values. So I've given you a lot of background information. What can we actually do to help support and manage the thyroid? And it comes down to a few things here. So stress management, adequate sleep, gut healing, dietary adjustments, as well as lifestyle adjustments. So we're going to get into that, starting with stress and the thyroid. Okay, so this is a huge one. Chronic stress leads to, just in general, chronic stress is very, very hard on the body. It leads to a lot of inflammation. For the thyroid specifically, chronic stress triggers those high cortisol levels, which can actually suppress thyroid stimulating hormones. So our TSH is lower, which then reduces our T4 and T3 levels, leading to decreased overall thyroid function. It also, these high cortisol levels, especially when we're in a chronic stress situation where it's, a constant stream of these high cortisol levels, it's impairing our T4 to T3 conversion. So we're not able to convert that inactive hormone to our active hormone to be able to actually work for us and do work in our bodies. And then I mentioned it on the reverse T3 slide. High stress actually reduces the conversion of T4 to T3 and actually kind of pushes it towards that reverse T3, which is inactive. Our body isn't really able to do much with it, and we're not able to get that proper thyroid function that we're looking for. Chronic stress also leads to increased inflammation and autoimmune risk. So stress actually, like I said, promotes a lot of inflammation, which can worsen Hashimoto's. It can also trigger immune imbalances, leading to thyroid antibody production. So kind of pushing us into that autoimmunity. So some tips for stress management. Stress is, we all live very busy and stressful lives. Some of us have very stressful jobs. And it is difficult to manage our stress, so to speak. So just some tips. Avoiding unnecessary stressors when possible, not putting yourself in situations that is going to stress you out. At least trying to limit those if you can. Setting boundaries and sticking to them. That goes with work, that goes with family, knowing when to say no, knowing when you have enough on your plate. Along with that, time management as well, making sure you're setting yourself up for success, and making it easier on yourself in the long run. Incorporating movement into your day is a really, really helpful stress management tool, as well as having a relaxation tool belt handy for high stress moments. So just having some methods, some things that work for you, whether it's deep breathing, whenever you do find yourself in a really high stress moment and you need to kind of bring yourself down. Getting into the sleep. So I'm sure you guys have heard of sleep hygiene. Basically, sleep hygiene is just, if we're not sleeping, let me back up. If we're not sleeping, that in turn is just going to already put our body in a state of stress, whether or not we're mentally stressed. Our body is stressed because we're not resting. We're not, having the time to clear out some of the things that happen when we're sleeping. So a good sleep routine is very, very, very important. And if anything, it's the first step in trying to get a hold of our stress. We need to be sleeping. So creating a bedtime routine is key, and staying consistent with it. So going to bed at the same time every night, putting away screens. Blue light kills our natural production of melatonin. So that's phone screens, iPads, TVs, video games, all of that. Reserving the bedroom for sleep and intimacy. This kind of trains our brain to only associate it with those things. If we read in bed, sometimes that can affect our sleep, as well as daytime naps. That can also affect our circadian rhythm. And then adequate exercise can also help with making sure we're getting adequate sleep. And some supplement recommendations targeted specifically at stress management. So ashwagandha, if you've taken any sort of like combination thyroid supplement, you've probably seen that ashwagandha is usually a part of that. That's because not only is it an adaptogen that's going to help just with overall stress levels, but it's also helpful in promoting the conversion of T4 to T3. We also have, rhodiola is helpful as well with stress management, L-theanine and GABA, magnesium, valerian root, lemon balm, and then B vitamins kind of in a, that helps with our overall just neurotransmitter, our brain function. So that can be helpful with stress as well. So getting into the thyroid and the gut connection. So the gut microbiota, which basically encompasses all of the bacteria and microbes in our gut, as well as their DNA. The amount of bacteria and the different strains of bacteria affect different things. So we have what's called, our good flora, and then we have our bad flora. So that's, bad flora is things that if our good flora is not growing correctly or it has died off because we've taken antibiotics, it's leaving room for the bad bacteria to grow, basically. So our gut microbiota influences the absorption of minerals that are essential for thyroid function, including iodine, selenium, zinc, and iron. So that right there, that alone, that our gut microbiome is affecting how we're able to actually absorb those minerals that our thyroid needs to function. That alone should tell you how important gut health is in all of this. Dysbiosis, which basically just means a disruption in that good, healthy, normal flora that I was talking about, actually leads to inflammation and an increase in intestinal permeability. So I'm sure you guys have heard of leaky gut. That's basically what that's referring to. It's causing a inflammatory cascade, which is poking holes in our gut, and it's allowing things in spaces that they shouldn't be in. And it causes, in turn, it's just this domino effect, this kind of ball that keeps rolling and turns into a bigger issue as we get more and more inflamed. So just an example of kind of those imbalances. In Hashimoto's, we have an increase in Bacteroides and a decrease in Bifidobacterium. And we've made that association. So it's a clear example of, how this kind of plays a role. And then lastly, I talked about how when we're converting T4 to T3, we're taking away an iodine atom. So this long word here, this thymine deiodinase, that is an enzyme that actually takes away that iodine atom. So these are actually found in the intestinal wall, and they directly impact our thyroid hormone levels. So if our gut is all out of whack, then we're not able to, pull those iodine atoms off that molecule and turn it into the active form. And then lastly, gut bacteria also play a role in accumulating trace elements such as selenium, zinc, copper, which are critical for thyroid function. So just kind of reiterating there. So when it comes to healing the gut, we have what's called the 5 R's of gut healing. We have remove as the first one, so removing stressors and gut irritants. So, cutting things like gluten out of our diet because we know that those are stressors, we know that those are irritants. Replacing with nutrients, digestive enzymes, or if you have trouble with digestion, sometimes acid, like stomach acid. Then we want to re-inoculate, which is done through pre and probiotics. So replenishing that gut bacteria, or our gut flora with good bacteria so that it can grow and flourish and we can heal up that gut. So getting into that, we have repair, which is repairing the gut lining. So sealing those holes that I was talking about that are caused by that increased inflammation and that leaky gut syndrome. And then lastly, rebalancing. So making adjustments in our lifestyle, which we'll talk about in a minute. But this is a whole separate lecture. I actually have done a gut health presentation as well, which gets into the 5 R's of gut healing and some supplement recommendations, which is on our YouTube page. So I'm going to leave it there for now. But if you'd like, we do have more information on that. So kind of along this gut health lines here, really anyone, but especially if you were dealing with an autoimmune condition or a thyroid disorder, an anti-inflammatory diet is key. So focusing on those whole unprocessed foods, prioritizing our healthy fats. Unfortunately, the standard American diet is very high in omega-6s, which is inflammatory and very low in omega-3s, which is anti-inflammatory. So by increasing those healthy fats, that avocado, that good cold pressed olive oil, and kind of flipping that can be helpful. Lean proteins, focusing on grass-fed meats and wild-caught fish. That way they're not, full of the things that we're trying not to eat, full of these heavy metals and toxins and things like that. Colorful fruits and veggies, these are rich in antioxidants and they help with oxidative stress, as well as high fiber foods. So that's gonna, help our gut. It's gonna help feed those gut microbes and help promote a healthy gut environment. So some foods to avoid in terms of diet. We want to definitely try to limit our refined carbs and sugars. So that's our white bread, our pastries, our muffins, our cupcakes, things like that, as well as sugary drinks and sticky candies, things like that. Processed and fried foods. So again, those are chock full of those omega-6s, very inflammatory. Our immune system does not like all of the inflammation that comes along with these foods. A big one is our dairy and gluten. I know that a lot of people don't want to hear it, but dairy and gluten are very, very inflammatory. I think sometimes there's a misconception thinking, well, I don't have celiac, so I can eat gluten. Really, gluten is inflammatory for everyone, whether you know it or not. And especially if you're dealing with a thyroid disorder, and especially if it's an autoimmune thyroid disorder, cutting gluten is a really big key here. And then lastly, alcohol and artificial additives. So our food these days will pack a lot of things, titled natural flavors. A lot of times is just a sneaky way to sneak some of this garbage into the food, basically, which leads to inflammation. Okay, so talking about garbage, environmental factors. So there are a lot of chemicals in plastics, pesticides, heavy metals, and other pollutants. We are well aware of, microplastics and all of the things that we kind of deal with in today's world. Unfortunately, this is one of those things that's a little bit more difficult to modify. There are some ways you can reduce your exposure to these types of things. Making sure that you have a good air purifier in your home and avoiding synthetic air fresheners and candles, as well as having houseplants. So we're increasing, that good quality air in our home. By buying organic vegetables, organic foods when possible, and limiting those processed foods, like we already kind of talked about, limiting that garbage that we're intaking. Invest in a high quality water filter, and along with that, using glass and stainless steel for our food and water storage. So not using single-use plastics. Those will leach microplastics into the water, and then we are consuming them. Checking for mold in your home. Mold toxicity is a lot more common than you might realize. So checking for that, as well as using natural cleaning supplies, are just some ways that we can decrease our exposure to these things. Okay, so fueling the thyroid. So what are the essential nutrients for optimal thyroid function? So I've listed a few here: selenium, iodine, iron, zinc, vitamin D, and our B vitamins. And I'm going to talk about a few of these. So selenium, it's an antioxidant. It is important in the metabolism of thyroid hormones. So it can actually, in patients with autoimmune, so in patients with Hashimoto's, supplementation with selenium can actually reduce those antibody levels that I kind of mentioned earlier. And our dietary sources of selenium it's in meat, in our fish and seafood, Brazil nuts, grains, eggs, and beans. And then I also included some supplement dosing if you wanted just kind of a range in terms of supplementing selenium. Then we have iodine. So we know that iodine is a big piece in our thyroid. We saw it on the chemical structure. And this is actually a trace element that is needed for the production of thyroid hormone, which we saw earlier. There aren't a lot of dietary sources. It's hard to get enough of what we need. That's why our salt is iodized. to make sure that we have enough adequate amounts of that iodine. And if you were to supplement it, I included supplement dosing there as well. And iron. So iron is required for the production of T4 and T3 in the thyroid gland. It's just another piece of the puzzle, so to speak. It's also involved in the conversion of T4 to T3, as well as the utilization of T3 once inside the cell. So it plays a big role, and sometimes it does get forgotten in terms. That's also why I kind of included it in the bonus lab values, because it can tell us a little bit more if we are having trouble kind of figuring out what's going wrong and where we're at. So there are dietary sources here. I'm sure you are, familiar with some of these, or familiar with iron, diet sources of iron. And then I included supplement dosing as well. Okay, so vitamin D. Vitamin D actually regulates it helps regulate our TSH secretion. So, being with the seasons changing and, in the winter we have less sun than we do in the summer, there is seasonal variability in our TSH levels. And that is in a healthy thyroid patient or a euthyroid patient. So the vitamin D levels will kind of vary in that sense. But a decrease in vitamin D leads to an increase in thyroid stimulating hormone, or TSH. And so supplement dosing for vitamin D, it does vary per individual. Generally, the starting dose is 5,000 units once daily as a starting point. And then we do recommend that you follow up with your doctor and get your levels checked after 3 months of supplementing with vitamin D, because you may need more, you may need less, just to get a more personalized approach here. So I know I threw a lot of information at you, but just as a summary, understanding your condition is a great first step. I know that all of these lab values and things can be pretty confusing, and understanding your condition, understanding what these hormones are and how they're kind of working in our body gives you the ability to be your own advocate whenever you are out in, seeing a doctor or getting labs drawn, things like that. So just kind of to summarize what we talked about, the big things here, I didn't touch on any of the prescription medications. I wanted to focus more on the functional aspect and how we can support, what we're already doing. We're already taking our thyroid hormones if we have been diagnosed with a thyroid disorder. But what can we do to make sure that what we're taking, we're actually getting benefit from? I mentioned all the gut health things, and the liver function and the kidney function. So if things aren't working properly, we can give hormones all day long, and we might not necessarily be wholly, completely fixing the problem. So looking at that stress management and prioritizing our good sleep hygiene and making sure that we're getting adequate rest, as well as some of those gut healing things I was talking about. And really, I want to emphasize that the dietary piece here, especially in those autoimmune conditions, is so, so important. I talked about the molecular mimicry, about how when we eat gluten, our body, it kind of recognizes the gluten looks similar to our thyroid tissue. And one thing about gluten is that, it's kind of an all or nothing kind of thing. So if you were, say you quit eating gluten for 3 months, if you were to have a meal that was high in gluten, you've basically restarted that inflammation, that cascade of inflammation, and it can take months to get back to where you were before you decided to have the gluten meal. So just kind of putting that into perspective, I think is good to hear, because I know it's hard to cut gluten, and there are a lot of alternatives available now, a lot more than there were 10, 20 years ago, but it is important that we do try to eliminate those foods, because you're going to set yourself up for success by doing that. Lifestyle adjustments and toxin reductions, and that's just kind of talking about those environmental factors that we can try to reduce. Of course, if you smoke cigarettes, not doing that if you can, decreasing alcohol consumption, things like that, making sure we're exercising, we're moving our body, we're eating well. So just making those overall lifestyle adjustments. And then, of course, regular lab testing and follow up with your doctor as well. Alrighty, and that is all that I have for you guys. Okay. Okay. All right. Well, thank you guys for attending this presentation. I hope you all have a wonderful rest of your day.